Hi friends, welcome to another episode of Dr. Arya's Vlogs. In this lecture, we will discuss part 2 of diagnosis and treatment planning in completely edentulous patients. So coming to clinical history taking, it is a systematic procedure for collecting the details of the patient to do a proper treatment planning. Personal and medical particulars are gathered to rule out general diseases and to determine the best form of treatment for that patient. So first one is personal data. In this, the first one is name. It should be asked to enter it in the record for documentation. When the patient is addressed by his or her name, it brings confidence and psychological security, and it makes more comfortable for the patient, and it also gives idea about the patient's family and community. So next one is age. It's an indicator of the patient's ability to wear and to use dentures, and it is important to predict the outcome of the treatment, and this refers to the physiologic age, and it provides information about patient's expectations and care for the dentures, used to rule out certain systemic conditions apart from determining the prognosis, and good healing abilities shown by 4 decades of life patients and greater than 6 decades showing compromised healing. So next one is gender. Generally, appearance is a higher priority for women than for men. Though younger men often are concerned with aesthetics, males often grow indifferent to their own appearances as they age. And during this process, men shift their concerns to comfort and functions of the dentures. And women facing the physiological and psychological problems of menopause often present as exacting or hysterical patients who are very concerned with aesthetics. Coming to occupation, it helps in setting up a convenient appointment for the treatment procedure and in tooth selection and arrangement. So executives in high-stress jobs may exhibit bruxism. For professionals, appearance and retention may be more important than efficiency. For public speakers and singers, they may need greater attention to palatal shape and thickness and also perfect retention. Wind instrument players may require special positioning of anterior teeth, and the patients in high socioeconomic groups may be more demanding and critical, whereas those of low economic status may show disinterest and poor hygiene maintenance. Coming to location, some endemic disorders like fluorosis are confined to certain areas, and people from that locality may want characterization or pattern staining in their teeth for a natural appearance. Then coming to habits, pan chewing, smoking and chronic alcoholism may modify the systemic status and concerns regarding hygiene, maintenance and wear of the denture. Pencil biting and nail biting, which may cause denture instability, and the parafunctional habits like crunching and bruxism may affect teeth selection and prognosis. So next one is the nutritional history. It is important to obtain a record of food intake of a patient over 3 to 5 days period. This helps in evaluating the nutritional status of the patient. And the ability of the oral tissues to withstand the stress of dentures is greater in a well-nourished patient. Dietary counseling is necessary in malnourished patients. So next one is the general health and dental history. A thorough and accurate medical history must be obtained during the diagnostic phase of complete denture therapy and must be updated as necessary. And the medical history provides important insights regarding the patient's dental prognosis. And the patients who exhibit good health generally are better prosthetic risk than those in poor health. Hence, the practitioner must be aware of local and systemic factors and must consider them during treatment planning. And the successful treatment requires an understanding of patient's general health, dental history, and thorough appreciation of the status of oral and perioral tissues, any existing prosthesis, be they successful or unsatisfactory. Coming to health questionnaire, it's a convenient method of collecting basic information and personal data. It can be sent to the patient before the appointment or administered in the reception area if facilities permit its confidential completion. Dentists can then review and clarify the information as necessary in the private operatory as part of the clinical examination. Coming to medical history, no prosthodontic procedure should be commenced without evaluating the systemic status of the individual. It is very important to take the medical history of the patient before going to complete denture procedures. So first one is debilitating diseases. The most common one is diabetes mellitus. And these patients show excessive rate of wound resorption, hence frequent lining may be necessary. And the patients having high risk of opportunistic infections like candidiasis show delayed wound healing and also salivary flow impaired. And in tuberculosis patients, they are very contagious and necessary precautions are required. And in blood dyscrasia patients require specific precautions if pre-prosthetic surgery is contemplated. And the mucosa is also more sensitive to denture pressure. And these patients having debilitating diseases require specific instructions on denture or tissue care and also require special follow-up appointments to observe the response of soft tissues to the denture. Next one is the diseases of the joints. Rheumatoid arthritis and osteoarthritis are common diseases affecting the joints. If fingers are affected, then the patient will find it difficult to insert and clean the dentures. When the temporomandibular joint is affected, special impression trays are required due to poor mouth opening, and frequent occlusal correction may be necessary as jaw relations are difficult to record due to painful mandibular movements. In cardiovascular diseases, it is always advisable to consult the patient's cardiologist before commencing the treatment. And these patients will require shorter appointments. And in skin diseases like pemphigus, having oral manifestations which vary from ulcers to bullae, such painful conditions make the denture use impossible without medical treatment. Constant use of the prosthesis should be discouraged for these patients. And neurological disorders like Bell's palsy and Parkinson's disease will present problems related to denture retention, maxillomandibular records, and support for the musculature. And the patients need to be educated regarding these anticipated problems. So in oral malignancy patients, some complete denture patients require radiation therapy before prosthetic treatment. A waiting period should elapse between end of radiation therapy and beginning of the complete denture construction. Only the radiotherapist determines this waiting period, and the tissues having bronze color and loss of tonicity are not suitable for the denture support. Once the dentures are constructed, the tissues should be examined frequently for radionecrosis. In epileptic patients, they may aspirate or break the denture during the seizure. It will influence the selection of denture-based material and the teeth. Patient and close relatives may also need to be educated on quick removal of the dentures prior to or during seizures. And in climacteric conditions like menopause can cause glandular changes, osteoporosis, and psychiatric changes in the patient. And these can influence treatment planning and the efficiency of the complete denture. And next one is medications. It can be an indication of a systemic problem, or dental treatment may be modified and influenced by the effect of the drug. So a common side effect of antihypertensives and antidepressants is the xerostomia or dry mouth, and this can decrease the denture retention and cause increased soreness. Diuretics cause changes in tissue fluids which affect retention and stability of the dentures. Psychotropic drugs can cause uncontrollable tongue or facial movements. Drugs can also act as synergist or antagonist to produce undesirable effects. Hence, the dentist must be aware of all the patient's medications. Coming to dental history, first one is chief complaint. It is recorded in patient's own words. It should be determined if the complaint is justified and realistic. It gives ideas about the patient's psychology. The next one is the patient's desires and expectations. It's important to find out what the patient expects from the treatment. The patient should be asked about his or her expectations. Unrealistic expectations will be detrimental to the success of the treatment, and the patient education regarding what is possible is very important in such cases. So, past dental history. So, the following information should be elicited. First one is the reason for tooth loss. If the periodontal disease was the reason, then more bone loss is anticipated, and it also helps in prognosis. Next one is the period and sequence of edentulousness. So longer the period, more will be the bone loss. By understanding the sequence, bone resorption pattern can be identified. And the previous dental and denture experience, the traumatic experiences will affect the attitude of the patient towards dental treatment. They will require more counseling and education. Patients' experience with previous dentures will give an insight into their attitude, desire, and expectations. So coming to the existing or current dentures, and the patient should be questioned about the length of the time he or she has worn the current dentures. Responses should be compared with clinical observations. The careful observation may provide valuable information about denture experience, denture care, dental knowledge, and parafunctional habits, etc. So coming to denture success, the patient should be asked about the aesthetics and function of existing maxillary and mandibular dentures. Responses may indicate the patient's ability to wear or adjust to complete dentures. Denture success for each arch should be rated favorable or unfavorable. Coming to pre-treatment records, it is very valuable information, and these records include information about previous denture, current denture, pre-extraction records, and diagnostic cast. Pre-extraction photographs, radiographs, cast, and facial measurements may prove helpful in denture therapy. These adjuncts may be used to recreate anterior aesthetics and facial support, as well as to aid in the evaluation of vertical dimension of occlusion. So in this lecture, we have learnt part 2 of diagnosis and treatment planning in completely edentulous patients. In the next lecture, we will discuss intraoral and extraoral examination. Thanks for watching. Stay home, stay safe.